Okay, so you see here, 36 hours after my treatment. That's called downtime. You see redness, you see elevation. Does this describe you? You're on skincare, you're on the right stuff. You're on a retinoic or retinol, a great vitamin C, you have a hyaluronic acid, a good moisturizer, and maybe something for brown spots. Maybe you're on a hydroquinone or kojic acid, you do some peels, but it just isn't enough. You're seeing a little sag, you're still seeing brown spots, the angles are changing, hollows under the eyes. You want something a little bit more than skincare, because your skincare is not cutting it. Skincare is great, but it's not quite doing it. You see it from the age of 25 or 30, collagen and elastin loss. What do? Here's the issue. You don't want fillers. You're not ready for biostimulators like Sculptra or Bellafill. And you don't want to look ducky, you don't want angles, you don't want to look like all those people that you see that are done. What are your options? That's today's video. So not everyone's ready for injections. At the end of this video, I'm going to give you a tip on how you can use this type of a product without getting any injections. With something like blood products, there's a lot of different variabilities. The concept is the same and translates over to fillers, skincare, microneedling, devices like RF microneedling. I'm going to talk about 4 facets of platelet-rich fibrin. And remember, we take your blood, spin it down, and it has the best healing factors, because what happens when you cut yourself, you form a clot, slow release of growth factors. You can barely see it. You might get a little scar. Some people don't even scar. It's a wonder of the world, but that's what we're doing inside the body. It's not skincare. Usually we're injecting this in some way, shape, or fashion, but it's all natural. I'll take you through why that is. Keep in mind, when people tell you about PRF, how to make it, the spin speeds, why it isn't clotting, why it does clot, are they people that are really injecting people? So people can tell you about it all day long, but if they're not doing it or not treating in patients, the science is just that. It's good to know, but you have to correlate that with clinical treatments. So it's most important that you listen to the people and take the science to those that are applying it in real life, because what are you concerned about? You're concerned about getting results, not spending a lot of money, or more importantly, wasting money. People are willing to spend money if they get the result. So not all PRF is created equal. In fact, I'm working to decrease the yield, to decrease the amount it produces, because you got to remember, there's only so many cells in blood. If you take a vial of blood, take 10 mLs, there's only a small percentage are the platelets, the white blood cells, and the growth factors that are going to recruit the stem cells that are in your bone and other areas in the body. So we want to concentrate them, so the more they're concentrated, the less side effects we have, meaning downtime. Downtime isn't truly a side effect, but some people would say, like my eyes are now, they'll say, hey, this is too much, there's too much downtime. I'm at 36 hours. If I reduce the amount and increase the concentration, I'm going to get a better result with less downtime. You hear people talk about the first generation of blood product, or PRP, platelet-rich plasma, and everyone brags about how much they produce. You can only produce so much goodness out of a certain amount of blood. There's a small percentage, and you can see in this diagram exactly the percentage that comes from, first of all, platelets, which is what we want, platelet-rich fibrin, platelet-rich plasma, and of course we want the white blood cells. So those are the 2 main factors, and the trick is the white blood cells weigh about the same as the red blood cells, but we want the white blood cells, which is why we have a slow spin speed. For me, I did our new PRF X protocol under this eye, and this eye was the traditional one. We'll see how they turn out. But in both of those, it's a matter of taking the cells at the right layer. With the PRF, it's much easier because it concentrates all the goodness in one area, and we can't get distracted so easily by this big production of fluid like you see in the PRP tube here, what we used to do old school. The next important factor is the angle of the spinner. So there are fixed angle spinners where the blood is put in the tubes, you spin it around and it's at fixed angles. And then you have horizontal spinners, so as it starts spinning, the tubes go horizontal and they spin that way. There's a lot talked about with that. The bottom line is the tubes that you get should be married to the spinner and they should be tested for growth factors. The only way to know, the platelets and white blood cells, a complete blood count is how you usually test that. But you have to test them because a tube in one spinner doesn't work the same as a tube in another spinner. And we want to get the white blood cells to the top. As evidenced by here, you can see I'm using a fixed angle spinner. Look at the tube over here. If you see the tube, it's not, the red blood cells are not on an angle, but rather straight across horizontally. And this is a tested system so that the tubes work with the spinner, with the speeds that we recommend, and also, of course, with the time. And I'm going to talk about the time to spin in a minute. The last point I want to make is there should be nothing in the tube. If there's anything in the tube, it's not pure natural as you would expect. A lot of people have heparin or sodium citrate, which are blood thinners. You never put blood thinners on an open wound and expect to form a fibrin clot. The clot is what heals. You pick that clot off, the skin or wherever the break in the skin is won't heal. It's the same under my eyes today. There's a fibrin clot under there. It was injected 36 hours ago, and that fibrin clot slowly releasing growth factors. Now there's one caveat here too. You got to check the tube. You might see nothing in the tube, great. And by the way, those who are activating it with calcium, we used to do that 10 years ago, or you activate it to form the matrix. That's not real PRF. It's unpredictable. And again, you're adding an additive after and a whole other step that the body doesn't have. We have our natural calcium that helps that activation chain. So that's another additive. But take your tube and look here, you'll see in this tube, you shake it up. If you shake it up, there's just water in here, and look at it, it should be clear. Some tubes have silica, other particles on the tube. If it's a PRP tube and it has a plug in it, that plug can be giving off, and likely is, impurities that you're injecting back in the body. So if your skincare is not working, you want to take it to the next level. You want to be pure, au naturel. Why do you want additives in the tube, silica in the tube, a plug in the tube? You want PRF, but you got to make sure it works. And the aforementioned issues that I talked about will help determine. Now, when you talk to me about my microneedling didn't work, I had Ulthera, it melted the fat in my face. I had microneedling RF for my neck. My neighbor got a great result. I went to the same person, I didn't get the result. Look what goes into making these products with PRF and with microneedling or other treatments, just about anything, including fillers, biostimulators. It's looking, assessing the skin and knowing how to combine them, knowing about energy levels, and knowing about what to do with an individual skin and switching gears if that didn't work. You can see if someone came to me and said, but Dr. Rajani, I had PRF, it didn't work for me. I'll get comments like that here. I love the comments. It helps us grow. It helps me stay educated. And most importantly, it gives value to all of our viewers. That's why I'm here. That's why you're here, to get value. Now, I can't tell you much as to why it didn't work, because though all those things I talked about in the production of the PRF are so important, how do I know that all those steps were taken? So someone comes into me and they're a newer patient, or they're a patient who's had treatments elsewhere of my own. They say, well, the PRF didn't work. I treat them anyway because how I'm producing it and how I'm making it, I get a high predictable result. Doesn't mean that it works in everyone, but I have a high predictable satisfaction with the way I make it, the way I do it, and that goes with all the procedures, and it goes for your provider too. Find a great provider who's passionate and looks into how they provide their treatments and looks at your skin as an individual. So if your skin's not working, that's a solution. I told you 2 bonuses. Here you go. If you don't want injections, a lot of people do microneedling pens. So you can put the PRF on the skin, use it with a microneedling pen. You're not getting it into the fat layers. You're not injecting it into the fat, into the bone. Or derma rollers. A lot of people use these at home, but you can derma roll this in. That's going to be 0.5 millimeters, sometimes 0.25 to 2.5 would be max, but you're still in the dermis. You're not injecting that deep. It has to be sterile, has to be clean, but you're not injecting it per se. And the other way, topically on the skin. We've seen it with acne, with people wanting glow. We can put it in topically. Your skincare is going on topically. It will deliver likely better than your skincare because it's isotonic with your body. So you're going to be able to get absorption of this product if you leave it on. And we know that from treating it and using it in so many different ways. Of course, it's better to be injected. Next is microneedling, and the next is topical. But if you really don't want something injected, you have options. Keep in mind, things like PRF are used in the eye for red eye. There's a way to use it for making the eye healthy. I'm not the expert on that, but I talk to people who do use it and like it. I don't have the protocols. I would like to. Maybe we'll dive into that. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.